Welcome back to the Not Your Mama podcast. My name is Kelly Bryant, creator and founder of Kelly Bryant Wellness. I am a personal trainer who helps new and expecting parents stop peeing themselves, get out of pain, and feel amazing. And I'm joined today on the podcast by Dr. Vicky Sekely. She is a personal trainer as well as a physical therapist, and she specializes in running. So I'm going to toss it over to you, Vicky, if you can tell us your pronouns. And I also want to know what your favorite emoji is, what emoji you identify as.
That's a good question. She/her for my pronouns,
Mhm.
and favorite emoji. Oh dear, it must be like one. You know what I use a lot that I just think goes with my personality is the emoji with the sunglasses. I don't
Mm,
know why. It's just like very just like you can kind of
just
use it in a lot
chill.
of different settings. Yeah, it's chill. It describes my mood a lot of the time. So, or
That's
maybe that's just the
great.
one I've been using recently. I've heard there's like 100 new ones now that I haven't looked into. So,
I
yeah.
forget. I found the first new one that I found. Oh, it's anyone who's listening to the podcast instead of watching the video will not understand, but it's the like capiche emoji.
Oh, I haven't seen that one yet. I
Yeah,
love
it's in
that
the
one.
series of the hands. There's a
Oh, I need to see that one. That I
yeah,
might have to switch to that.
that's the first new one that I found, but it's funny
Amazing.
because the emoji that I associate with you, this is gonna sound
Yeah.
creepy, but I swear it's going somewhere good, is the peach emoji. Because like all
Oh,
your stuff is like
glute work.
so good for your glutes and your hips. So
Yes.
it's not
Okay,
like
I'll
a
take it.
creepy, I associate you with the butt emoji.
I'll accept it. I'll
It's like
accept it. I
I
love
feel
it.
like I want to slap the peach emoji on like everything that you do because it's all so good.
I love it. Maybe I should start using it more.
100%. So tell us a little bit more about you, your professional background, how you kind of got into both running and training runners.
Yeah, so I started out playing tennis actually. Both my parents are big tennis players. My mom was pretty much 9 months pregnant with me playing tennis. I basically was born on a tennis court. Like, let's just put it that way.
So
I
Serena
think my
Williams is
parents,
your mom.
yeah, basically. I wish. Oh my God, that would be amazing. But yeah, so my parents met on tennis court. We've just been a big, big, big tennis family. And that's kind of like how I pretty much played tennis every single day of my life. So not a single day went by without like working out or doing something active. And that's really been kind of like the defining moments of my life as it leads to today, because I don't really play tennis much anymore. But also, my parents being really active, my mom was kind of not really so much a big runner, but she always liked to challenge herself. So
Hmm.
she signed up for a half marathon. Had a ton of fun doing it. And the next one that she signed up for, she was like, hey, why don't you do it with me? And I was 12 at the time, so really young. But I was playing like 3 to 4 hours of tennis pretty much daily. So I was, I guess, strong and also had a lot of endurance. And I just fell in love with running from that age. I think it had a big also a big factor in that was that I ran for myself, and tennis really became a sport where I was kind of, my whole family played. It
Mm-hmm.
kind of became something that I didn't love that much anymore. And running really became my outlet from tennis, which sounds crazy because then it's like, whoa, are you ever sitting down and like
Right,
not
right.
doing something? Which that's exactly what I feel like I never was really sitting down. I was always pretty active, especially when I was younger. But as I grew older, once I graduated from college, I was able to really pick up running more so, and it became more of my dominant sport. And to be completely fair, I never really competed after that first half. Like, I didn't sign up for races. I didn't do anything outside of just kind of getting out for myself. And
Mm.
it really was one of the biggest stress relievers. It was something that I just loved doing, and I did it purely for myself. I didn't want any kind of PR. I didn't want to do anything with that. And that's how I fell in love with it. So that's kind of my background in running. In terms of physical therapy, obviously that's joined as well with my love for just being active and getting outside and movement really. And both of my parents, again, they're in the healthcare field. So I felt like my life was kind of always going in that direction. And physical therapy was a nice combination of both athletics and also movement and healthcare. And so, yeah, ended up at NYU for my doctorate of physical therapy. And that's, kind of where the journey began. And that's where I got my CSCS, which is my personal training certification. Did that while I was in school. It was a requirement for my school as well, which seems, at the time was kind of annoying. We had to do it on the side and study for it while we're also taking courses, which was a lot, but extremely helpful. And then once I graduated and got into my first real job, I just realized that running was my passion. I was working in an outpatient orthopedic setting, so I was around a lot of different sports, a lot of very active people. And I just found out that my eyes lit up every time I worked with runners. And I just felt a lot of empathy. I felt like I could relate. And that's pretty much where I am today.
Yeah. And
sorry, that was a lot.
No, absolutely. It's so good to like get that background of like, you're coming to this from it sounds like from what you're saying, it doesn't sound like you ever really experienced a lot of these injuries that presumably your patients present with. So I guess my first question is, does anyone ever come to you before getting injured? Like, is anyone actually thinking ahead?
All the
And
time.
yeah. So then you also do get a lot of people who are coming to you in a PT context where they are injured. Do you see, is like the majority of your clients, are they runners at this point? Cool.
That's a great question. And to say that I've never been injured is a false statement because I've definitely been injured. And I kind of, I guess I left that part out of the story is I really didn't find my passion in running without getting injured. So when I was in PT school and my first year of working, I got injured myself, and I found that the best way to rehab is through strength. And I was like, I'm a runner. I'm just like every other runner out there. All I want to do is run, and really you kind of can't just go out there and run every single day. There has to be a component of strength to that. And after I rehabbed myself, I was like, wow, like that is where this is it, like I need to kind of share my knowledge and my information. So that is really where it came from in terms of the running as well, which I've left that part out, but it truly is an important factor. But yeah, to answer your question, so do I get a lot of, what was your question? Sorry.
You got it, which is really just the idea of like, runners hate to strength train. And I feel like for people who don't necessarily know you or know your platform on Instagram, like the majority of what you're doing, at least public facing, is not telling runners like, run this pace. You're not telling them so much how to run as you are telling them how to not run, like how to do all of the things that aren't the running part of it, which no runner wants to do.
I love that. I love that you put it in those kind of clear terms. I'm not, I am also a run coach. I've taken a bunch of run coaching certifications, but I don't really see myself as more, I'm definitely physical therapist first. And I know a lot of run coaches who are like, just, get out there and run. It'll be fine. It'll work itself out. Do your yoga on the side. And from what I've learned from my own injuries and from what I've learned from working with tons of runners at this point is you have to get familiar and you have to get actually a very close relationship with strength training before you can really find your potential as a runner. And that's really what my Instagram page is about. It's like, yeah, run. That's what you love to do anyways. I know you can do that. We'll get to some people who, struggle with that as well, because of course there are, but it's really the hardest part is building a routine that also incorporates strengths because a lot of runners just, they want to run. And it's just kind of not feasible for long-term runners. And the majority question that I get from clients who approach me is, or the number one goal that they have is, I want to run for the rest of my life pain-free.
Mm-hmm.
And like, while that might not be realistic, because, there's aches and pains here and there, the best way to prevent an injury and to rehab from an injury is strength.
Mm-hmm.
So it's as simple as that.
And this is exactly where the Venn diagram of what we do overlaps, because
Exactly.
I tend to see the kind of subset of like injured runners who are specifically like prenatal or postpartum runners who are like, how do I either prevent or rehab from this very pregnancy specific injury? But before
Yeah.
we dive into the pregnancy and the postpartum, I would love if you can, we've kind of like alluded to this, I don't know if it's like a broad generalization, but like this generality that like runners get hurt a lot. Why? Why are runners getting hurt so much? What is it about running that's so demanding? And what is it that tends to cause injury if people aren't appropriately strength training? And I want to put that caveat. It's only if people aren't appropriately strength training. But why does this happen so much?
So I want to start with one of my most favorite statistics or quotes is 80% of runners run at 80% intensity, and 80% of runners get injured.
Mm.
So it's because runners, our bodies like variety. If we do the exact same thing for the majority of our workouts, our runs, whatever it is, our chance of getting injured is higher.
Mm-hmm.
Right? So it's just like the same, if you go out there, you run the same distance, you run the same pace, you're running the same shoes, you're doing the same thing every single time, which is what most runners do, because they don't really have like a training plan. They just kind of are getting out there. They have, 8 hours of work after, they just want to get it done. That's how you're going to get injured. So our bodies really learn and they get stronger through variety. And that includes strength training, that includes changing up your runs, that includes speed work, that includes, endurance work, and that includes cross training really too. So that's why we see a lot of runners getting injured, because again, we go back to the kind of number one thing we've been talking about is runners love to run. And we have to kind of incorporate other factors and other variables that ends up getting injured, which makes you injured. But to also talk about the demands of running, I'll pull from my brain one of my other favorite quotes is, you don't run to be fit, you need to be fit to run. So running is hard, right? You are on one side of your body for every step, for 1,000 steps a mile. And every time you land on one side, 2 to 3 times your body weight goes through that one leg. When else does that happen in your life, right? So if your body, your muscular system, your joints, your skeletal system, if it's not prepared to handle that load, it's going to break down. And how do we, the next question I get is, well, doesn't running make me stronger? Not really. Running helps you get used to running, and it helps you in terms of endurance wise. But if we're really talking about preparing our body to handle that specific amount of load, we need to talk about strength. And so a lot of the strength that I deal with my runners is just getting people more comfortable to lift heavy, and that's something that, a lot of, you'll even hear it from some doctors too. It's like, oh, don't squat with like more than your body weight, or don't do lunges ever again. And I'm like, that literally sets me off. I'm like, first of all, you need to squat like probably at least 10 times a day, every time you're going to the bathroom, every time you're sitting down on the couch, every time you're sitting down on the chair, like, and you're telling someone to avoid doing that. Like, that just doesn't make sense to me. So it's always, training and preparing our bodies for what we're going to ask them to do. And running is hard. And a lot of people don't realize that. So that's another major factor.
I feel like you said in a much more eloquent way, which is what I'm constantly telling my clients who want to run, is I'm like, running is jumping on one leg forward over and over again. Like, it's balance, it's plyometrics, and it's single leg, which is like just ridiculous. And if you ask someone to move through like a running movement pattern at like 1/10 the speed, they can't do it.
Challenging.
They literally can't, they don't have the balance, which means that like we're relying on essentially momentum.
Yep, absolutely.
as soon as you go into momentum, you start to get like real questionable with where you're displacing force. And we're getting like a little bit technical for the for
I
the
know.
listeners who are like, like, I was woken up 4 times last night by a crying baby. What about momentum and force distribution? Like,
No, but
it
it's
wrecks your
important.
stuff. It like
Yeah.
messes you up if you're like,
Yeah.
kind of just relying on speed to get you through that single leg balancing. And
Right.
like when I watch your like your training moves that you do
Hmm.
in your runner strength classes, it's like
Hmm.
all single leg, bent knee, not necessarily knee behind ankle, like
Right.
moving through like a natural movement pattern.
Yeah.
Um, and
Absolutely.
so to just kind of like touch on a few of the injuries that I see
Yeah.
commonly, I want you to add whatever you see, like plantar fasciitis or just general like foot, heel, calf issues,
Hmm.
knee stuff.
Hmm.
That's a very specific injury, knee
I'll
stuff.
take it. Yeah.
And of course, the knee stuff often gets attributed to like tight IT bands, which I know you have thoughts
Yep.
um, about rolling IT bands. And shoot, what was I going to say? Oh, well, with my prenatal and postpartum clients, like there's always peeing, like there's always
Right.
vagina
Pelvic
bladder,
floor. Yeah.
yeah, stuff. So those are kind of the most common things I see. What did I
Yeah.
forget?
So are you talking in general, like
In
postpartum
general,
population,
like
or just in
things
general?
people, so maybe the way that we frame this for people is like
Yeah.
if you run and also you have these things, that it might be related to the running.
Yeah, I mean, you did really well. I would probably add like Achilles tendonitis. So you could
Mm.
include that and your like
Mhm.
plantar fasciitis, because
Mhm.
I think that they go close, hand in hand.
Mhm.
I like your generalization. I actually do shockingly like your generalization for knee stuff, because there's a lot of
Drama.
different types of knee pain, and I shockingly almost always treat it the same way. So a lot of people don't get that. And like there's a lot of variability that I'll give based on your specific conditions and maybe how you are specifically as a person, but it kind of all comes back to the same one,
Mhm.
general idea, which we can get into later. Definitely
Mhm.
IT band, which a lot of people think is solved from rolling. We can get into that a little bit too. Hip pain I'll see a lot as
Mhm.
well, and not something I see that much, but low back pain also
Mhm.
can be a contributing factor. And a lot of that like hip and low back stuff is just
Mhm.
just core work and just stability work.
Yeah, the
Yeah.
hip and low back stuff, I think almost with my postpartum people, like they don't even
Hmm.
start running. Like they're just like
Yeah.
they have it, from
Right.
pregnancy and from not training appropriately through pregnancy and then going into postpartum and everything kind of like
Yeah.
atrophies and everything's all like loosey goosey from
Yeah.
birth and pregnancy and they just stop. They're like, I want to run, but I have all
Yeah.
this pain. I'm not going to go try.
I know.
Thankfully, they're usually like, I have excruciating low back pain or hip pain. I'm not going to go try to run right now. But
Right. Right.
shoot, what was I going to say? It was something about the knees. Oh, I don't treat, right? So like that is outside my scope of
Yeah.
practice. I don't treat
Right.
acute injury. I don't diagnose. So when someone
Right.
is doing a training plan with me and they're like, my knee hurts,
Yeah.
my quote unquote treatment is always the same. It's always like, well, let's look at your knee.
Hmm.
Can you move through your knees full range of motion,
Yep.
loaded with
Yep.
stability? And
Yep.
like,
Absolutely.
I don't, and I mean, I think it's helpful, of course, if you have a healthcare background, it is within your scope to like actually diagnose and treat. Of course, it's helpful to know like, oh, this is
Exactly what it is.
specifically this ligament or it's cartil, like whatever
Sometimes
it
it's
might be.
not, though.
Mhm.
Sometimes it doesn't matter. And sometimes it's
Mhm.
actually worse. And this is where I get a lot of heat and maybe some hate from like doctors, because really they're all about like diagnosing specifics. And like even some of
Mhm.
my patients and clients will get annoyed, but it's all about like, it's kind of more, let's talk more about not specifically what a diagnosis is. Again,
Mm.
not a specific ligament or tendon
Mhm.
or whatever we're talking
Mhm.
about, but let's talk more about, okay, what like what can you do?
Mhm.
What can't you do? And how do we kind of take it from there? So it's
Mhm.
not so much about like specifics, it's more about like the general assessment and how that goes. And I
Totally.
think that some people are so hung up on like, okay, but what exactly would you call this?
Yeah.
And it's like, I don't have to call it anything. I know how to treat it. So
It's
it doesn't
called your
really
knee
matter.
hurts.
Right,
Stop.
exactly. Yeah. But yeah, people are really, and I get it. It's like, coming from, if you don't really know what's going on, you want
Mhm.
to label it so badly.
Right.
But that's, I think, also the problem with our population right now is they immediately want to get like an X-ray or an MRI.
Mhm.
And if you get an X-ray or MRI,
There will be
you're
problems.
probably gonna find something, and
Yeah.
that's gonna make you more crazy because most likely it's not the
Right.
cause of your pain.
Right.
So it's like you're just gonna create more pain from doing that. And it's, I
Right.
get it, but I think we have to kind of start to move away from that specific diagnosing and all of that.
And like this is all so in alignment with the way that I train, particularly around pregnancy and postpartum, because
Yeah.
there's never a better time to get in touch with your intuition and
Right.
your ability to just like be okay with the I mean, as humans, like it is our nature to label and to categorize and
Yeah.
to organize things and to feel that gives us a sense of security and control and safety. And like for anyone who's still pregnant right now who's listening to this, like you ain't gonna have that. Like that is gonna go away. When you're a parent, you don't everything is not going to be like orderly
Right.
and labeled and organized. And at some point, like you have to be able to take all of that authority that you've given over to medical practitioners and
Mm-hmm.
give it back to yourself to
Yeah.
just say, and my rule is always like, when I'm injured or sick, I
Mm-hmm.
start by doing the first thing I think the doctor is going to tell me to do. So that I've saved myself a trip to the doctor and potentially I already
Money.
fixed it. And then if I have to go to the doctor still, I can be like,
Right.
I already tried that.
Right.
That didn't work. And we're like so afraid to do that with our
Yeah.
own bodies. And if you're becoming a
Yeah.
parent, like you have to now do that for another being. So
Yeah. And I think something that we also forget as humans, but specifically postpartum and even like, when you're pregnant as well, is our bodies are amazing. They
mhm,
are incredible. And
mhm,
if you have pain, more than likely your body is already working to heal or fix that
mhm,
area. And that is something that I feel like a lot of people forget about, that our bodies really do the majority of the work. Yes, we
mm,
need some guidance in terms of like movement and like how to not create compensatory patterns
mhm,
in terms of pain, but just trusting your body and
mhm,
recognizing that like it is already doing things to help. Like my best example is an ankle sprain, you
mhm,
know? Yeah, your ankle immediately swells up. And some
mhm,
people are like, oh my God, my ankle's swollen, like this is terrible. The ankle swelling is
mhm,
literally your body healing the ankle sprain. So like we're so scared of like swelling and like all of this type of stuff, but we don't realize that like that is our body doing its job.
mhm,
So it's like not being so afraid of that and like kind of recognizing that we have all our bodies are really amazing
mhm.
is like step number one, and then that kind of takes the fear out of it. And then sometimes that can actually lower your pain too, because pain is super complex and a lot of it has to do with anxiety and fear and,
Yeah.
and everything too. So it's just like one step. And I think that that's important to recognize.
And this is like a really great place to just like plug rice.
Yeah.
Rest. Wait, am I going to get them all? Rest, ice, compression, elevation. Did I get it? Yes.
Totally. Yeah,
Woo,
absolutely.
mom
I,
brain.
I have to, can I just quickly say something to that though?
Yes.
Unfortunately, the rice technique is kind of, I know, I'm sorry. I don't mean to say it's wrong,
Right.
but it's kind of taking different forms now. And again, a lot of people will get on me for this. I don't always ice.
Yeah.
And
Ice
let's
is the
talk
one that I don't typically do either.
right. And I might not always rest. So that's another thing too.
Right.
If
So,
it's like, and
right.
if we're talking more about like runners, let's kind of
Mhm,
bring it back to like my, what I love to talk about all the time.
mhm,
If there's so many runners that get like a tendon injury, so we're talking about like Achilles tendonitis, like some, IT band, whatever we're talking about there, rest doesn't really improve that much. Maybe a day, maybe it's like a training error and you just kind of overdid it. You need to take a little bit of a break. But I have some people who come to me, they're like, I rested, I stopped running for 2 weeks and now it's worse. And I'm like, yeah, you probably shouldn't have stopped running for 2 weeks because now you're in a worse place than you were before, because we can't really kind of remove that and then expect to put it back on and be totally fine. You know,
Shit.
a tendon
Vicky,
injury.
have you done a whole episode about this on your podcast? So I'm like, crap, I have so many things I want to talk to you about now. Because
I know.
like, yes. So anyone who's listening to my podcast, go back to episode 5 because we talk about yin. So when I say rest, what I mean is yin work.
Love that.
Which is just a different type of energy.
Yes.
It's movement.
Love that.
That's like in a different, I don't know what to say other than like the woo woo, like it's just a different energy.
But totally, that is a different mindset.
Yeah.
You know, like that's exactly what I'm talking about. I'm not saying sit on your couch and elevate your leg and stop doing things. I mean, granted, there are times like, for
when
example,
you break your leg.
things we don't mess around with, exactly where I'm going. Things we don't mess around with are stress fractures. We do not, as runners, we do not mess around with that. That is when you offload the area completely for several weeks. Literally anything else, you load it. So like, you know, yes, maybe you're not running at your max. Maybe you're not even running for a couple days, but that doesn't mean you're resting. That means you are loading the tendon, proper strength training, proper, like, you know, kind of getting your body reset really is a good way to put it. And I think that's similar to what you're talking about. That's the focus, you know? So I think rest in the, like, and I think a lot of people sometimes are scared to like move that body part, and that will make it worse in the end.
Totally.
Yeah.
So like, oh my God, how did we get here? Intuition.
I know.
So where we were going with this is like, while we're using the idea of rest, like very maybe kind of atypically from like what people might be used to thinking of it. And of course, your people probably have like a much more, because they're runners, they're probably much more like rice. That means I have to like elevate for 30 minutes and ice it. Like they probably have like a much more stringent protocol.
100%.
And that's not what we mean. What we mean is just this idea of like, use your common sense. I'll give an example of like, I recently just was having some rotator cuff issues. I've never had rotator cuff issues in my life. I started a new training plan that was significantly more push-up work at more depth than I was used to. So like it started to hurt. I gave it like 2 or 3 days of continuing to train. That made it worse. So like, it was like, well, what do we think we should do? Like I stopped doing push-ups for a week and a half and it's better. Like, but the whole time I was still continuing to like move my arm through its full range of motion, doing pulling exercises, like using, personally, I just really hate being cold. So I totally use heating pads instead of ice. I'm like, no.
100%. I'm with you on there. I will literally, unless it's like the most swollen thing you've ever seen, I will almost always heat it.
Right. Because like something like, and I don't want to get in the weeds of like specifically rotator cuff tendonitis, but like something like a rotator cuff, like a lot of the time it's a muscle is tightening and restricting, and that's creating a tug on the tendon. And when you freeze muscles, they just tighten more. They just get more constrained.
Right. Yeah. I mean, I think that's exactly what you said. I also want to touch on what you mentioned just now too, is if someone's telling you to like do a, you know, without talking to you, just do a very generalized thing, like ice 30 minutes, rest 30 minutes, heat, you know, like that kind of thing. Don't listen to that, because every single person is different, and it has to kind of be like based on you and what you can tolerate. And that makes it hard, but that's why it's important to seek the right type of help when it first happens, you know, like especially if it's even just a conversation, like especially if you absolutely know nothing about what to do. Don't just listen to the guidelines. Don't like, you know, Wikipedia or WebMD or whatever it is, because most likely it's going to be more personalized to you, and slapping an ice bag on there for 30 minutes might do more harm than good.
Right.
So, it's important to ask questions early on.
This is such a good callback to the previous episode where I had Christy Brown on, and she said almost the exact same thing that, like,
Yeah.
she, of course, is in a totally different realm, which is intuitive eating. And she's like, everyone
Yeah.
wants to just be told, do this. Like,
Exactly.
this is what you have to do. And, like, unfortunately, or
Love that.
I would say fortunately, we're
Yeah.
all unique individual human beings that, like, for me, I think even if I was like swollen like a balloon, like, I have such a strong emotional reaction to being cold that on a
Me too.
nervous system level, like, icing something probably is not going to help me. And that's
100%.
personal. There's other people, like, if you were, a college football player, like, you probably take ice baths and you're like, ice is not a problem. Like,
Yeah.
stop being a
Or you
baby.
might like it, or you might
Yeah.
like it, and it really is a lot of that stuff also might be trial and error. So also,
Mhm.
if you're listening to this and you like put a bag of ice on your swollen ankle yesterday, like, don't freak out, like,
Right.
it's not the worst hasn't happened. Just when you're doing these things, like, it goes back to our last conversation, be mindful and be like, do I feel better? Did this make me feel
Mhm.
better? Do I feel worse? And that's not just 5-10 minutes after, that's 24 hours after, 48 hours after. Like,
Mhm.
when you're injured specifically, that is when I would want you to tune in even
Mhm.
more to your body and just kind of really just take a backseat and listen to how it's
Mhm.
responding to different things. And then, make a note of that. Every injury is different, so it might not work again, but we live and we
Mhm.
learn. You try something out. If it doesn't work, you don't try that again. It's like
Right. And
we
it's
learn. Yeah,
hard, man, to, like,
it's
learn
hard.
how to listen to your
Totally.
body instead of listen to
Yep.
your ego. And this is
Yeah.
like for my
Oh
cardio
yeah.
junkies, the way that you get through, I'm gonna hate on my cardio people for a sec. You crazy people. The way that you get through running a marathon is saying things to yourself like, "This is amazing." Like, you have, like, I don't wanna say
Mindset.
lie to yourself, but, like,
Mindset.
you
Yeah.
totally push yourself
Hmm.
past discomfort. And
Yeah.
so you are literally consciously down training that little voice inside that's going like, "I think I'm injured. I think I'm hurt." And of course, like, you don't like, you have to learn, like, how to
Yeah.
balance
Balance.
the part, and I know you're a spin person too, like, you have to learn how to balance the part of your brain that is like, "I am certainly going to die on this bike,"
Absolutely.
against the part of your brain that's actually like, "Hey, boo, like,
Something's up.
this is
Yeah.
actually pain. This is actually a
Right.
problem."
Totally. Totally. I think that's kind of similar to, I mean, I don't know much about intuitive eating, but you said the last
Mhm,
episode was on that. I feel like the kind of generalized statement between that and exercising too is just kind of learning.
mhm,
Every day you learn, you listen. And I think a huge part too is we don't recognize how much other factors come into play as well.
mhm,
Eating, nutrition,
mhm,
hydration, sleep, rest, stress,
mhm,
like all of those come into play. So it could be, you kind of have to just take a back seat
mhm.
and listen.
Right. Which I feel like this is a great place to tie this in for our pregnant and postpartum people.
Mm,
Um,
mhm.
so I can throw out some of the things that I see a lot, and I think, gosh, I wish I could remember how you said it exactly, but it was like the idea that when something is injured, you need to load it. And that
Mhm.
is such a scary, difficult
Yeah,
thing to do postpartum. For me, the
totally.
um the specific one that always like comes up with running is pelvic organ prolapse, where if you
Absolutely.
are laying in bed doing nothing, it's really hard to recover those tissues because like
Yep,
they have to have demand. So
absolutely.
this is why I tell people, like, especially if you're passionate about getting out there and running again, I tell people to start like 2 weeks, 3 weeks, do your like deloaded, just like lay in bed and be like, can I talk to my pelvic floor? Like, can I
Right, right.
figure out how to engage things so that you can progressively get to the point where you're like, okay, now I can walk.
Absolutely.
Now I can squat. Now I can single leg squat. Now I can actually single leg jump. And then like you get to the point where you can go back and run. But you don't want to go 0 to 60. You also don't want to stay at 0. If you don't
Exactly.
ever reload, it doesn't just come back.
Right. I think that you made a great point, and I want to kind of like explain the terminology that I'm using, especially the
Mm-hmm.
word load, because immediately when I say load, you think like weights and like
Mm-hmm.
adding, but load, it depends on where you're at. So
Mm-hmm.
adding load could literally just be, again, finding that connection between your mind and
Mm-hmm.
your core and your pelvis or whatever it is that you're working for. And load could be holding a pelvic tilt for 10 seconds. I
Mm-hmm.
don't necessarily mean like adding a weight week one, day one, you've never
Right.
lifted a weight before in your life. It's more like find where you're at and start slowly. Like there is no rush, and our bodies, it takes time to heal and it takes time to learn. So start from wherever you're at, but loading really just means like I guess just starting where you're at and starting to strength train,
Yeah.
really.
The way that I
Yeah.
describe this a lot, especially with things like balance. So like when I make
Yeah.
people do, say, an example of like a single leg deadlift. So if we're going to talk about like a single leg deadlift progression, like I'm going to start at a
Yeah.
kickstand, body weight,
Totally.
kickstand, like just can you forward fold and come back up to standing without like biting it?
I would
Great.
even start double leg
Double leg.
hinge.
Yeah,
Like
totally.
just hinge.
Yeah,
Like just work on the motion. Like get the
right.
motion down, that's first.
Yes. And this is, I feel like, where we need to like say, like, go to both of our Instagram pages. Cause if you're like deadlift,
Totally.
what? Like,
Yeah, absolutely. Right.
so there's, we've got pictures and videos for
Oh
this,
yeah.
but yeah, you have to progress through and what I call own every inch of the movement.
Mm-hmm.
So particularly with people who are used to running or used to cardio or used to fast-paced movement, I want you to be able to slow it down to a tenth the speed and feel like you can still do the whole
Mm-hmm.
movement without pain, without falling over, without losing your balance, all of that. And
Yeah.
then you progress
Yep. It's
and
really
keep
movement
progressing.
with control.
Mhm.
And that's something that I found, like, unless we're talking agility and speed work,
Mhm.
I will never tell you to do an exercise quickly, like
Mhm.
ever. I will always, it can only improve it to do it slowly and to kind of break
Mhm.
it down. And if you can't do it slowly, break it down even further, because that's like, it's never going to benefit you to do something fast paced and quick, again, unless you're working on agility, which is
Right.
usually way down the line,
Mhm.
not where you're starting from. So
Right.
exactly what you said. And I think just the word control,
Mhm.
like that's a great way to kind of describe, like, and you can tell, did I feel in control of that
Mhm.
movement? Yes or no? It's not, it's like kind of easy to
Mhm.
sense that yourself. So
Right.
that can
It's
be a
not
really
something
good
that I'm
guideline.
gonna, well, I mean, sometimes I can look at
There,
someone and be like, "You're
yeah,
falling over," like you didn't
right,
control that,
right.
but you
But
can
you
have a
as a
sense of it
person, yeah,
yourself.
exactly. Yes.
And it's funny because my clients who I've had like a year plus, like
Mm-hmm.
a year in, I'll be like, "So this month is going to be focused on like power." And they're like, "What?" And I'm like, "Yeah, we're going to do like quick movements." And like, of course, I think it's hilarious that I've spent a year being like, "Slow down, slow down, slow down." And then we finally get to where I'm like, "Okay, we're going
All
to do
of a
power
sudden.
work now." And I'm like, "Hurry up. Come on. Like, let's go."
Totally.
They're like
Yeah.
trying to do kettlebell swings like slowly. I'm like, "No, come on. You got to
That's
swing
not
that
the
thing."
purpose of, yeah. Again, different ideas and different types of exercises, I guess. But when we get to that point, our bodies need to learn how to do both.
Yes.
So especially if you're running.
Yes, 100%.
Yeah.
Yeah. And
Yeah.
that's a big part of this too, is like also think about like
What
what
your
do you
goals are.
want to do and what
Yeah.
does your daily life demand?
Yeah.
Right?
100%.
So, I have some people who have like more physical jobs and I have some people who
Yeah.
have, I mean, carting around a kid is a very physical job. So
Demanding. Yeah.
that's like I I just posted on Instagram the other day. Like I had my daughter who's 2 and like 30 pounds, like in a carrier and jumping. Like that is a very like a 30-pound vested jump, like plyometric work is like a
That's
very
hard.
specific type of strength. And
Right.
that doesn't just like happen. Like you have
Mhm.
to actually
No,
train for that. And it's
absolutely.
very exciting for me to be able to be like, "Oh, I feel 100% in like I own this movement."
Yeah.
I'm also 2 years postpartum.
Right. And you kind of you know what you're doing and you've also worked at it. So
Right.
that's what happens
So if you're like the cool thing about babies is that they progress you. Like they come out
as
and they're
they
like
grow.
7 pounds or whatever, and you have the opportunity, if they don't
Yeah.
start like inching up ahead of you, you have the opportunity to build your strength in
Right.
tandem with their weight, which is
Absolutely.
for a lot of the people I train, like that is the
That's
greatest
awesome.
demand that they put on their body is just being
Yeah.
able to move their kid. So it's like
Right.
if you've got this 6 pound weight, that's essentially just your body weight. Like start with body weight exercise, just,
Right.
like we were saying, like 2 legs on the ground, just hip hinge, just squat,
Exactly.
like
Just the motion.
and
That
then build up the weight over time. And of course, by the time
right.
you have a kid who can run away from you, you also want to be physically able to run
Run
after them.
after it. Exactly.
It's like
That's
these
so
things, it's
funny.
like Mother Nature had this beautiful plan in mind.
I love it. Our bodies are amazing. That's really it.
So I know that like every ounce of your physical therapist brain is going to be like, I can't give you one answer. But if you could give us one answer,
Yeah.
how would someone test if they're ready to go back to running?
Uh, um, yeah, that is hard, but I would say, very generally, again, because we've already talked a lot about specifics, but
Mhm,
very generally, if you cannot do um, general like strength exercises like a squat or a deadlift,
mhm,
and especially if you can't do any plyometrics,
mhm,
I honestly would not say you're ready to run.
mhm,
And I think that's shocking to a lot of people. And I actually get a lot of people who come to me who are like running, and then I ask them to do a jump squat and they
mhm,
can't do it and they fall apart. And
mhm,
what I say to that is, guess what? Our bodies, especially when they're running, are really, really good at compensating.
mhm,
They're really good at getting you from point A to point B, right? But if you're compensating, that is going to break down.
mhm,
So yes, you might be able to go on those few runs and like do a little bit here and there. But
mhm,
if you can't do the basics in terms of strength, which really I would say plyometrics, so like the jumping
mhm,
exercises, you're
mhm.
not ready to run. And that's
Right.
just, it's very plain and simple. Most likely you will get injured if you can't do the
And
basics.
it actually blows my mind that I have people all the time who, when I was teaching group fitness classes, 20 people in a room, like there
Yeah.
would be people who would just be like, "Oh, I don't jump." But
Right.
they run.
Run.
And I'm like,
Running
"That's
is jumping.
jumping." Like,
Yeah.
that is the
No,
same
it's
thing. And the fact that your
right.
body can't do it when you're
Yeah.
stationary on the like,
Right.
2 legs, it's a really clear sign that you should not be running. And
That
I
is
d
pretty much like a non-negotiable for me. If you're a
Mhm,
client of mine and you tell me I don't ever want to jump, but I want to run, I'm like, then you have to find someone else to work with. Because
mhm,
if we can't get you to the point of jumping, like I will
mhm,
never think it's okay for you to go out for a run because running is jumping,
mhm.
just like
Yeah.
what we said before. And your body will break down if you're not training it specifically in that way. And guess what? Jumping is hard and running is hard, but like I said, like we come out of the womb. I mean, not come out of the womb being able to run, but we run at a very early age,
Mhm.
right? Running is kind of
Much earlier
built
than I would
into
like.
much yeah, exactly, much earlier than most parents would like. But I think that we don't recognize again that like our bodies are really, really good at being like, oh, it's kind of like a fight or flight response. Like,
Mhm,
yeah, it'll run if you tell it to, because that's kind of how we are as humans. We have to run away from, a bear that's
mhm,
going to chase us.
mhm,
But if you're going to ask it to do that multiple times a week and for quite a long time, 10,
mhm,
15, 20 minutes, it's going to break down.
mhm.
Like, that's just kind of the harsh reality of it.
So, I'm gonna I know you're not necessarily a pelvic floor
Yeah.
physical
No.
therapist, so
Right.
you can totally pass on this question. But any thoughts on the whole running and peeing thing? Because the first
Yeah.
time someone, like long before I ever had kids, was talking to people who had never had kids, and they're just like, "Oh yeah, distance runners just pee themselves." And I'm like, "What? What?"
Yeah, I mean, again, if that's happening to you, see a pelvic floor specialist. That's my 2 cents. But really, what it comes down to is core strength. Your pelvic floor is part of your core, and if you're not able to, kind of keep that area stable, and you can't control it. And running demands a lot of core and hip strength. I think a really good, not analogy, but a really good visual is, we always want to compare ourselves to the people who do it best, which are the elite runners, right? The ones that win marathons have the least amount of hip and pelvic movement, right? So the more we can stabilize that movement, which, by the way, every movement, every time we move our hips, it wastes energy, or it doesn't waste, but it's energy to move. It uses energy. The more we can stabilize that and use our energy elsewhere, that makes us better runners. So if we kind of think about that visual, the more we can stabilize our hip and our core and our pelvic region, the better we get at running. So if you don't have that stability, a lot of other issues are going to happen, like peeing yourself when you run, things like that. That is, a major thing that people don't really talk about. Like I said, see a pelvic floor specialist, number one, because I think it has a lot of different exercises that you can go through there. And I don't think it's a one size fits all model. I'm not going to sit here and just be like, strengthen your core.
Yeah, right. Do 12 crunches. No.
I'm so sick of people saying that. Like, it really is just very frustrating to me. But what I would say is, don't just strengthen your core, but make sure you're doing very running specific exercises if that's your goal.
Yeah.
Right. So don't just
practice
do
jumping.
Exactly. And which does get your core involved. But it's like all of those exercises that really, it comes down to pelvic floor stability. And that's kind of what we have to strive for. That's pretty much my 2 cents.
So interesting. I don't think I've ever put it together from a sense of if you actually want to be a very good runner. P.S. This is why I'm not a very good runner, because when I run, I look like one of those inflatable flailing arm mans, outside of a car dealership.
So
that's what I look like when I run, which makes sense why it takes me 12 minutes to go a mile, because there's so much wasted energy. That's super interesting.
Exactly.
And one thing I do want to plug here, 100% go see a pelvic floor physical therapist,
Yeah.
but you can have urinary incontinence from being over tight too. So when Vicky and I say strong in your core and pelvic floor, part of strength is mobility, is not just being, so tight that your bladder is in your throat, but actually having the ability to brace. It's the same as your foot, right? You don't want a Barbie foot that doesn't move through your ankle. If you're going to run, you need to be able to move through the full range of motion of any body part that's involved.
Exactly. Well, that also comes back to number one, you need to get a proper assessment to see kind of what the main issue is. But it kind of, you start to think about why things are, if you have that situation, why are things overly tight? And almost always it's because they're overworked and they're just getting really tight to try and create that stability that you need, which is, again, kind of the same issue as they're just not strong enough.
Right. A primary mover isn't doing what it's supposed to.
Which a lot of it is also learning how to relax and really, which is huge for runners too, is how to breathe. And that's a huge part of how your core, your pelvic floor moves as well. So all of those things kind of tie in, and you and I were never going to sit here and tell you exactly step by step what exercises to do to get there. You kind of have to, it's very
see an actual person.
Exactly. Yeah.
It is the information age, but the internet will only get you so far. So
Sometimes it's our worst enemy.
this feels like the best segue into I'm going to ask you about a very specific exercise because you post
Oh,
it all the time.
great.
Tell me
Do
about
it.
these calf raises.
My favorite. So in terms of calf raises, well, first of all, I think I don't give seated calf raises enough love because those are definitely, kind of the same thing as a standing calf raise. But the reason that I love and that I post about calf raises a lot is because it's a really easy thing you can do at home. Don't need a gym for it. B, an often overlooked exercise. And C, the calf muscles are, I actually think the soleus muscle, which is one of your calf muscle, I'll get into that later, produces the most force out of any muscle in your body at push off when you're running, which is like, you would never expect that, but you have to take that into account as a runner. So if we're talking specifically about runners, calf strength is one of the most overlooked exercises. Again, you can do it anywhere. You don't need equipment. And it really, really does a lot for you. So like sometimes I'll actually have a runner who comes to me with hip pain. And this is going to sound kind of crazy, but sometimes the issue is their calf muscle is weak and their hip is doing way too much work. And it's trying to push them off when really your calf muscle should be taking over. And they, that's their hip doing too much work. Sometimes it's not necessarily a hip problem. That's why, physical therapists, we always say we always look up and down the chain. I think that's really important, but I think that's often overlooked. So that's why I love the calf raise exercise. And I would highly recommend that. Actually, I would put, in our conversation earlier as one of the factors of whether or not you should be running. If you cannot do 20 to 30 single leg calf raises in a row, you should not be running.
I think you posted something like that and my brain was like, whoa.
I know.
And because of you, I have started like probably 2 months ago or so, I started putting more calf because I realized I was like, I don't program anything for calves because I'm not a runner. Like it doesn't even occur to me. So I started for my people who either walk or run.
Absolutely.
Or have knee or ankle issues, knee, ankle, foot issues. I've started putting calf raises in their programs.
Yeah.
Amazing. It makes such a big difference.
To that note too, so in terms of let's just talk like anatomy wise in terms of the calf. So there's two muscles that form the calf. One is the soleus, which is like the deeper muscle, and then the other one's the gastrocnemius, which is really the one that you look at when you look at your calf.
I can never say that word. I'm like
just say gastroc.
Yeah,
say gastroc.
Like gastro. No, that's confusing.
Yeah, no, that's yeah. So in terms of the soleus muscle, what people don't realize is that muscle is the one that keeps you upright when you're standing. So if you're someone who stands a lot during the day, like if you're cooking a lot, if you're standing like for meetings, things like that, that muscle needs to be strong. So if you're doing literally anything where you are upright, you need to strengthen your calf muscle. And I'll probably, if you're sitting a lot during the day, you need to strengthen your calf muscle too, because you will be walking at some point.
And it's so interesting. Like it's something so simple, but I was working with a client and I gave her calf raises to do and one leg totally fine. Other leg, I'm like watching her foot and it's like rolling and she's making all of these compensating patterns. And I mean, as soon as I brought awareness to it, she was able to like adjust. She was like, whoa, that feels really different. But she was able to adjust it, still touching a wall. But she went home and she told her husband, and her husband was like, oh, I've always thought you had kind of a weird stride on that side, that like that hip is less stable. There's more like, and we've talked about like her cadence, like her cadence does funny things on that side that like corrects itself when she's on a treadmill because they're contained, but when she's on the road, like that whole side is like all, I don't want to say like floppy.
No, yeah, that's
unstable.
Correct. Yeah, unstable. I would even, when the feet hit the ground, like that's what touches first. Like if immediately you have instability from that first main joint, like how do you expect the rest of your body to be stable, and without any kind of like crazy compensation? So it's super important. similarly, just like generally the foot as in
Mhm.
itself. But that's also why I do a lot of balance work as
Mhm.
well, and barefoot.
Yes,
And
thank
people hate
you.
me for that.
Thank
Yeah,
you for
it's
saying it.
all about barefoot.
When and like, so we so need to wrap up, and I hate to do this,
Yeah,
but I'm
I
like,
know, that's okay.
ah,
I know.
bare feet. I'm like, okay, you're telling me that when you do things barefoot, you
Yeah,
have more discomfort or pain or whatever. And so your solution is to not be barefoot?
right.
That's craziness to me. Like, that is
No,
something telling you, like, hey, we have a lack of stability, a lack of strength somewhere in this chain,
exactly.
probably at the foot, but somewhere in this
Exactly.
chain. And our
Yeah.
solution, it's like saying, like, well, my bicep is really weak, so I'm gonna just like put it in a sling
I'm never going to use it
and
again.
not use it anymore. It's
Yeah,
like your
I know.
feet are
I
full of
know.
muscles. And of course,
I know.
this is me coming to it from, my first fitness love is
Yeah.
yoga,
Yeah.
which is
Yeah.
everything
Exactly.
barefoot. And, when I
Exactly.
was a new baby teacher, people would be like, my feet are really sore after class. And I was just like, weird. Like, totally
That's,
didn't like get like, oh, it's because you wear shoes all
yeah.
day, you do nothing barefoot, and you never do any balancing work.
Yeah.
And so
Yeah.
those muscles
That's
have
it.
completely they're gone.
Right. That's exactly it. I mean, the foot is so important. And, they're even calling it the foot core now because there are so many muscles that really stabilize. Yeah. I love it though. I love it so much because it's so true. It's all about stability. And there really are millions of muscles in the foot. And being barefoot not only strengthens them, but builds back that connection that we were talking about before, that mind body connection that
Mhm.
if you lose that,
Mhm.
that's, you have to have that in order to help prevent further injuries. And
Mhm.
shoes really don't do us justice there.
Yeah.
Yeah, they protect us from like the ground and like
Right.
I don't know,
Sharp
like
things.
rocks and maybe things. But yeah, but we have to be really. We could have a whole other
Yeah.
episode about this. But yeah,
To tie it into pregnancy and
yeah,
postpartum, there's actually like some people who teach on this, like who propose that the arch of the foot is a mirror of what's happening in the pelvic floor. That,
yeah,
like, when you get pregnant and the shape of the pelvis changes and the musculature of the hips change and the knees often get like real wobbly and kind of knock
yeah,
in, and we see
yeah,
the arch of the foot drop.
yeah,
That getting that arch back up when people start, so if anyone wants to do some homework, just
yeah.
stand with your feet flat and see if you can lift your arch. Not roll your
Mhm.
foot open, but just lift your arch like you're sucking your ankle bones up. You will
Yeah,
feel that up your whole inner thigh to your pelvis, like, without a
right.
doubt.
It's creating that brace and it's creating that stability that really
Mhm.
again starts when your feet
Yeah,
hit the ground.
it's your
But
cushion too, right? It's
yeah,
like the same, all of the
exactly.
curves that we have in our body. If you
Yeah,
look at most of our bones, they're straight.
right.
When all of these straight, hard bones are formed into curves, it's
Mhm.
because we need cushion.
Yeah,
We need some trampoline effect. So when we have
right.
spinal curves, the bowl of the pelvis, the bowl of the diaphragm, or the
Mhm.
what's their
Yeah.
opposite? Dome,
Cur
dome of the
Dome.
diaphragm and the dome of the feet, it's because the body needs that.
Yeah, absolutely. Our body again, tying it back, our bodies are amazing. They were meant, they were made a certain way for that reason and
Mhm.
kind of just got to work with it,
Totally.
work on it.
All right.
Yeah.
Take us home, girl. Anything that we didn't touch on, and how can people work with you?
Oh, well, I'm on Instagram, Train Smart Run Strong. I have a website too, which is the same thing, trainsmartrunstrong.com. In terms of I feel like we covered a lot.
Thank you so
I
much.
always love talking with you because we can just get on, these like we have so much to say to each other, which is fantastic. We could
We just need
literally
to schedule
have
a
just
date.
episodes. I know, right? It's like, and that would be long. I'm
Yeah, I
telling you.
know. I don't.
Um, but no, I feel like we covered a lot of it, and really just it comes down to listening to your body and
Mhm.
recognizing that your body's amazing, and not kind of really putting yourself in that place where it's like, oh, I need like these extra other factors. Like you just kind of need to be patient with it and
Mhm.
work on it, and you'll get there. And patience really is key at the end of the day, especially for
Awesome.
running.
And
Yeah.
if someone wants you to tell them how to run, you're like, Is that one-on-one, groups? How do people do
Yep.
that?
So I have a Tuesday like strength for runners workshop.
Mhm.
I probably wouldn't recommend doing that right off the bat because it is pretty high level.
Yes, it
If
is.
you
I
want
look
to,
at the
yes,
the
it's
exercises and I'm
tough.
like, "Oh,
Um,
snap."
if you want to work with me one on one, there is a form on my website that you can fill out that goes directly to me, which is how you can reach me. And yeah, that's, just take a look at my Instagram. I respond to every single DM, unless it's like some ridiculous comment or
I
like
was
a
gonna say
troll, which I don't
some
respond
man trying
to.
to pick you up.
uh, I'm like, there's no response to that. Or like someone who is just telling me that I don't know what I'm talking about and they have like 2 followers. And I'm like, well, I'm not going to listen to you. So happens all the time. But
That's
yeah, no,
wild.
I respond to every DM that is like, actually trying
Meaningful.
to, yeah, meaningful. So that's another way as well. And yeah, I do most of my stuff on Instagram, I'd say.
Awesome. Thank you
Yeah.
so, so much for being here,
Thank
and this
you.
has been wonderful.